So, hello to all dear students. The INI CET exam just got over, and this session by Doc Tutorials is just on the first impressions of the INI CET paper. So, I can see that many students have already joined. Well, I'll just tell my analysis based on the feedbacks that I got from the students. By the way, I hope that my audio as well as video is clear. So please let me know in the chat box if my audio and video is clear. Okay, right. Okay, right. Shall we start? Shall we start? Right. Okay, let us start. So whatever analysis that I'm going to give you is based on the polls that I have put in the academic groups in WhatsApp and Telegram, and based on the direct feedbacks that I've got from the students who have given the exam. I personally have not given the exam, so you can just point out whether anything that I say is factually incorrect. I'll try to be as accurate as possible based on the feedbacks and the polls that I got from the students. Okay, right. So first of all, for a student who has prepared decently well for the INI CET exam, I think this was an okay paper. So when I conducted the polls as well, around 60% of the candidates were saying that the exam was of moderate difficulty level. So I had put the polls easy, moderate, tough. 60% had said that this is of moderate difficulty level. Okay. Now, going to the further analysis, many students told me that there were a fair share of questions from the previous year topics, and those students who had done the previous year topics very well were benefited. So that is another input that I got from the students. And even some students told me that there were some direct previous year questions as well. Okay, so that is what I want to tell you. But something that I got from the students is that though many previous year topics were repeated, but many students found difficulty in dealing with two options. So they say that the options were slightly twisted. They were able to eliminate two options, but for certain questions, they were confused between two options. So though the number of previous year topic based questions were considerably good, but again, quite a few options were confusing for many students who gave the exam. Okay, right. And regarding the image-based questions, the feedback that I got from the students were that it was not too much compared to the previous INI CET. On an average, around 20-22 questions is what majority of the students told me. Okay, so around 20-22 questions of the image-based questions. Then I asked the students, from which subjects did maximum questions come, which prof had more representation. And the answer that I got from majority of the students is that the second year subjects, second prof subjects, and that is expected. Second prof subjects, patho, micro, they are very, very important and had a good representation for this INI CET exam is what I understood. And also the questions from first year also were there. I heard that a good number of questions also came from biochemistry. Anatomy, I got a mixed feedback. Some students said that it was pretty much doable, and for some students, it was not that great. Okay, and next point is one crucial aspect, and this is something that I was also looking out for about the time management. I specifically inquired with a lot of students on whether they had any issues with the time management, and as well if any particular block, because as we all know, this is divided into 4 blocks. If any particular block was too much lengthy, the feedback that I got from the students was the time management was okay. And except in the first block, this is what I got the feedback from the students. In the first block, some students had issues with the time management, and even for the session that I did yesterday in the Doc Tutorials YouTube channel, I also made a specific mention that the first block, there is always a chance that you might take more time in getting into the momentum. So the first block, for some students, there were issues with time management, but the block 2, 3, 4 were relatively okay. And many students told me they got sufficient time just to quickly review the questions as well. This is what I got the feedback from the students. Okay, right. Now, if you ask me, sir, what is going to decide the rank this time? I personally feel, based on the feedbacks, is that there were quite a very good number of questions wherein more than one choice was right, like multiple correct options type, and you had to choose. I think that, according to the student feedback that I got, you can also let me know in the comment section. From what I understand, over 50 questions were such sort of questions where, more than one correct was there. And I think many students told me that, sir, this questions, we are having some doubt. I was just confused between two options. So I personally feel that these are going to be the rank deciding questions, because see, you have just given the exam. This is just a session on the first impression. So only once you come out with the proper options, because even when you discuss among yourself, if you recollect only a part of the option, there is always a chance of error that can come, in the recalls as well. So once you come up with the full options, we'll get to know more regarding this. But I personally feel, as of now, I think this is going to be the rank decider questions. These are, and I can see in the, many of you are saying that yeah, the first block was slightly tough. Aisha also says the same. Okay, right. Okay, right. And then I hear that there were quite a good number of questions from gene mutations related, and also some criterias also were being asked. That is again pretty much expected for INICET. Now, any surprises? Well, for the exam, I found a few surprises. Number one, from what I got from the students, there were no ECG based questions. Please correct me if I'm wrong. No ECG based questions. Am I right or wrong? No ECG based questions, number one. Number two, no questions on new drugs. Usually in INICET, they do ask questions based on new drugs, but I've not got any question based on new drug yet. But I hear from students that we had some questions based on drug interactions. Yes, Aisha was also saying that no ECG based questions. Number three, no questions on stroke. This is another feedback that I got from the students. There was no questions from stroke topic, correct or not? No questions from the stroke topic. And number four, usually in INICET, at least in certain blocks, you do get very lengthy questions, but I did not get comments from students saying that, sir, the questions were lengthy. I never got such a feedback. So what I understand is, we did not have too much lengthy questions which would destabilize your, momentum while you give the exam as well. Okay. So I want to tell you that another point is, I asked the students, nowadays there are many students who rely just on shortcut resources alone for preparation. And from the majority feedbacks that I got from the students is that those students who relied only on shortcut resources, okay, they found the exam very tough. Now, this is what happens when you only rely on these shortcut masala stuff. Students who attended the regular batch and then attended a program like, say, a high impact training or a CPR or whatever platform you are following, that particular the program, that might have actually helped. But again, purely relying on shortcut resources did not help, is what was understood. And Dr. Aisha is telling a comment that there were many statement based questions. Okay, many statement based questions were there. Okay, fine. And so some students says that did not revise biochemistry questions. So did not revise biochemistry. So Dr. Shailesh found it relatively tough. And any other comments you want to actually tell? And one thing I'll tell you, the first impression from my side is that this is relatively high scoring. I'm not saying it is easy paper. Just because majority of the students told me, sir, yes, So many questions were from previous year topics. My gut feeling is still that once you dissect the options, you will definitely find that many questions are tricky. So I cannot say a definite conclusion that this is definitely easier than the previous INICT. Superficially, topic wise, it looks like, familiar topics, that is definitely there. So if a student has prepared decently well, in that case, you will be able to get good scores. And I can see, yeah, PCAN, they had asked. Okay, right. And let me again tell you that for this particular paper, if you make silly mistakes, it is going to cost you. Okay, it is definitely going to cost you if you had done silly mistakes, because in such papers where the topics have been selected, in such a way that they are familiar to the majority of students who have done a decent preparation, any silly mistakes that you do here can be fatal. Okay, right. And when I asked students who have done a decent preparation, majority of them attended 190 plus. I'm hearing 195, 200, 198, 196. So all this with decent preparation, they have all clocked above 190. Okay, right. And regarding the medicine questions, well, I'll just quickly go through the topics which I have collected. Neurology, I think the topics, I'm just telling you the topics. I'm not going for the detailed recall right now. We'll be coming up with the recall videos in the doc tutorials app, and whatever recalls that we'll be doing will be authentic. We don't want to come up with half baked recalls, and that is always dangerous. Sometimes, when you come up with such recalls, the options, only if you get the correct framing, we'll be able to tell the right answer even as faculty. So we are also waiting, we are also collecting the questions, and we are getting the authentic questions, and we'll be coming up with full-fledged recalls in this very YouTube channel. So please stay tuned. Medicine, if I may quickly go through the topics from which questions have been asked. Multiple sclerosis, then eye of tiger sign, I think quite expected. Ring enhancing lesions. Somebody told me there was a question on normal pressure hydrocephalus. Then another question was on the EEG waves. Yes, EEG waves. And side effect of anti-epileptic drugs were asked. Then question about REM sleep. Then lupus nephritis with wire loop lesions treatment asked. Question based on pulse. Another question which was scenario based on the heart failure with preserved ejection fraction. And I think there was another question on heart failure as well, asking not a feature. Then a question on mitral stenosis. Coming to pulmonology, questions on bronchiectasis, pulmonary function test, COPD. Then endocrinology, as expected, the questions were regarding the endocrine physiology, and like the ADH mechanism, question on insulin like growth factor 1. Then I think patient had a severe diarrhea, mechanism for hyponatremia. Then coming to rheumatology, a question on rheumatoid arthritis. Systemic lupus erythematosus, again, very important topic. They asked about the earliest manifestation. There was question on ulcerative colitis, question on multiple myeloma, question on the management of septic shock, and certain general questions like, all the malignancies are associated with obesity except I think a couple of questions on drug interaction as well, genetics questions on Turner syndrome. So this is what I got these topics. Now, these are just the topics. Detailed recalls I'll be, coming up very soon for all the subjects. But there is one important message. I want all of you to listen to me for the next 2-3 minutes. All of you to listen to me for the next 2-3 minutes. Listen to me. Look, INICT is over. Okay. You might have done well. Maybe your performance is average, or maybe you have not done well. Whatever it is, NEET exam is coming up. You have got two options in hand. Number one, just keep thinking about the INICT exam alone and pondering too much into, how much correct answers you got. But that is only going to waste your time of preparation for NEET. I would strongly urge you, take a day off maybe today, just relax. But from tomorrow, go full-fledged for NEET. But if you keep thinking about INICT, even if INICT was disastrous, please understand, if it was disastrous for you, maybe it did not go your way. People are saying that, INICT was, okay, but for you it was tough and you're feeling the pressure. But I just want to tell you, have faith in yourself and have faith in resources that you have got. And for the next few weeks, give it everything that you have. everything that you have. And just because you did not do well in INICET does not mean that you have no chance in NEET. If you give one full-fledged revision, you still stand a chance for NEET exam. That is what I want to tell you. Okay, it's very, very important. Now, another point I want to tell you, very important, very important. The results of the INICET will come in a few days' time, right? Now, for all my dear students who have not got, assume that you have not got a good rank for INICET, that should not demoralize you, because if it demoralizes you, it will affect your preparation in the coming few weeks. So if you have got any such negative thoughts, I want all of you to keep it aside and keep preparing for NEET exam. Trust your resource, trust your revision. Revision is very important. One good revision can turn a relatively average preparation to a good one. So please make sure that this final round of revision that you're going to do is a solid one. Okay, so that is what I want to tell you. These are the initial impressions, first impressions, and we wish you good luck, and we'll be looking forwards to hearing from you once the INICET results are out. But again, I want to tell you, I want to assure you that if you put in good effort, you can still make it to a good rank in NEET exam. If you want any other queries to be answered, you can please quickly ask me in the comment section, any queries. So I can see Dr. Shailesh telling me that there was question based on von Gerke's disease, microbiology question on Hymenolipsis nana. So, right, fine. So that's it from my side, and stay tuned to the page for more such updates. And I can see that there is a best wishes from Shivani ma'am, our ophthalmology faculty, for all your students, all our students. Okay, right. Thank you so much, everyone, for joining, and stay tuned for the detailed recall. We have got a more detailed analysis coming up tonight. So stay tuned to the channel for the detailed analysis as well as individual subject recalls. Thank you so much, everyone. Okay.